Okay, so we are back. For those who are still around, should kindly join. Let's quickly finish up the live session. Sorry for the interruption. My laptop session. Sorry for the interruption. My laptop. I lost power. The battery was down, and I didn't notice. I lost power. The battery was down, and I didn't notice. So for I'll continue. If you come back online, you watch the videos, because I don't know when I'll be free to do this video again. If you come
Hello, good evening, sir.
So I'm back.
Okay, sir.
And so for those who are available, should kindly join so that we'll finish up.
Okay, sir.
All right.
That now, sir.
All right.
Thank
Change. No. Okay. We will not waste too much time. I will have to start. Okay. We will not waste too much time. Okay. So this question says that the following are indicators for ICU admission for acute pneumonias. So you should know that for acute pneumonias, there's what we call CURB-65, CURB-65. All are indications. Is a scoring system that you use to talk about the severity of pneumonia. So which of the following are indications of ICU admissions of acute pneumonias, except hypercapnia, that's high level of carbon dioxide, hypotension, altered cesareum, acidosis, hypertension. So from my record here, it's only one person that joined. So, do you have an idea on the answer? There's any ideas? Okay, we have 3 people already. So, which one is not an indication for ICU admission in patients with pneumonias? So, which of the following, in other words, is not used to assess severity of pneumonia? That's what it means. Any ideas? I will give you 30 seconds, then we'll move forward. We are racing against time. Any ideas? Or I should answer it? Okay, Mahmoud Musa said E. Anyone else? Okay, so Mahmoud Musa, you're right, is E. So some of the hypercapnia is an indication for ICU. In the COP65, the B is blood pressure. So when the blood pressure is less than 90/60, it's a score. Altered sensorium, that is the C, consciousness level, is a score. Acidosis is also an indication for ICU admission. So hypertension is the answer. Very good, Mahmoud. Okay, so let's move. So the next question is, the following are types of bronchial asthma. I don't know if they taught you, but this is also basic information. Types of asthma. You know, asthma has several types. So the question is, which one is a type of asthma? So we say atopic asthma, aspirin sensitive asthma, non-atopic asthma, childhood asthma, allergic asthma. Any ideas for the 3 people that are here? Any ideas on the answer? Which one is not a type of asthma? So you see, the questions that you are being asked are basics. They are not too... Okay. Wow, we have almost 12 people have joined already. So let's be active. Let's be active. Once again, I apologize. The power of my battery ran down, and I did not notice till the very end, so I had to charge it again. Okay, so okay, Mahmoud Musa said D. Ashiri said D. Okay, any other person? Okay, Fatima also said D. So it's D. There's nothing like childhood asthma. When children are little, sometimes they can have bronchitis. Anyway, when you go to pediatrics, they will teach you asthma. So atopic asthma is the same thing as allergic asthma, right? Non-atopic asthma is also the same thing as non-allergic asthma. Then you talk about aspirin sensitive asthma. This aspirin sensitive asthma is seen in people taking aspirin, and people that are sensitive to aspirin are usually seen in adults. Okay, very good. All right, let's go to the next one. The following are characteristics of acute severe asthma. That's the severest form of asthma, except inability to complete a sentence in one breath. Okay, tachycardia, hypotension, tachypnea, peak expiratory flow rate of 35 to 50%. So which of this is not a characteristic of acute severe asthma? Okay, so for those who are doing pulmonology, this should be a walkover, unlike those who haven't done pulmonology, because also as a you need to differentiate when you see an asthmatic patient whether it's an emergency or not. So usually, okay, Mahmoud say E. All right. Any other person? You can make an attempt, then I'll explain. Okay, and the recording will always be on the channel, so you can go back and listen to it again. So the answer is C. So for acute severe asthma, there is inability to complete one sentence in one breath. There is tachycardia, there is tachypnea. The peak expiratory flow rate is, okay, I actually got it, is between 33 to 50%, but there is no issue with hypotension in acute severe asthma. It's not the characteristics of acute severe asthma. So the severity of if acute severe asthma is not properly taken care of, it will lead to life-threatening asthma. So here is the question: is the following are characteristics of life-threatening asthma except? So that means acute severe asthma has progressed to life-threatening asthma. Okay, so which one is not a characteristic of life-threatening asthma? If anybody has an idea, you should answer, or I'll move to the next. Okay, someone said none of the above. Okay, so actually the answer here is D. So in life-threatening asthma, you have silent chest, bradycardia, hypoxia, but you do not have hypercapnia. What you have in life-threatening asthma is hypoxia. The partial pressure of oxygen is low, but there is no hypercapnia. So if life-threatening asthma is not fully treated, it will lead to what we call near-fatal asthma. Near-fatal asthma is when the individual is almost about to die. So this one, I will answer it myself. Okay. So near-fatal asthma is the one that have the characteristics of the acute severe asthma plus hypercapnia. Once you see that the partial pressure of carbon dioxide is going up, that means it's near fatal. The patient is almost gone. Okay, so that's why the best time to treat the patient and reverse the problem is at the level of acute severe asthma. Don't allow it to go to life-threatening or near fatal asthma. Okay, so I have answered this one. I hope you understand. Okay, so for the next one, I need answers. The following are used for the treatment of acute severe asthma. If you have joined your unit to do call, you must have seen one or two cases of asthma. So which of the drugs are not used? Do you use nebulized salbutamol? Can you use magnesium sulfate? Do you use 50% oxygen? Do you use aminophylline? Can you use ipratropium bromate? Which one is not used? I'm not asking you how it is used or the steps, but which of these options is off? Any answers for me? Or I can answer and explain. Okay. Okay, Mamu say B. I should say B. Okay. Any other person? Okay, so this one is also equally important. If you give salbutamol, you give hydrocortisone, it doesn't work. You can give magnesium sulfate. The catch here, pay attention when they ask you best of 5. There are certain changes that they make. So is the catch here is 50% oxygen. The oxygen is 100%. For asthmatic patients, we use 100%. You only use low percentage oxygen for chronic obstructive pulmonary disease, COPD. Okay, but for asthma, you use 100% oxygen. Okay, so that's the catch there. So pay attention to these small changes that can be made by your lecturers. Okay, so all those drugs that are here, including the oxygen, is required, but not 50%. It should be 100%. Okay, so we have finished pulmonology. Any question on pulmonology? I want to give you a minute. Does anybody have any question in pulmonology? We are going to infectious disease, which is the last for today. If we have time, if I have time, I can do for gastroenterology and nephrology, but infectious is the last. Any question on pulmonology? If there are no questions, please type go ahead so that we'll go ahead and start infectious. Ashuru, Mahmoud, Bilal, Fatima. If there are no questions, just write go ahead so that I can move. Okay, so Mahmoud said I should go ahead. All right. So the next question is infectious disease. We'll run down what I have here. So you said which of the following are examples of the species of malaria except? So which one is not an example of a species of malaria? We have Plasmodium falciparum, Plasmodium knowlensi, Plasmodium vivax, Plasmodium malariae, and none of the above. What is the answer? Which one is not an example of malaria or the species of malaria parasite? Which is not an example of a species of malaria parasite? Okay, waiting for your answers. Okay, I should say none of the above, none of the above. Yunus also, Patience also. So you people are all correct. So all these are species of malaria parasites. So the answer is none of the above. Okay, very good. All right, so let's move. Which of the following is not a feature of severe malaria? So which one will you say if a patient has is the best of 5? So which one is not? Okay, so acute renal failure, severe anemia, hypoglycemia, body weakness, coagulopathy. Which one is not part of the features of severe malaria? Severe malaria has components. I don't know if your lecturer taught you those. I don't know the scope of your discussion that day. You people took a lot of time that day. So I don't know if you touched this area. But okay, Mahmoud said D. Okay, any other person? Okay, I should have said D also. Okay, Khadija also said D. So it's true. D is the answer. There is posturation, right? Severe body weakness that limits any kind of activity, but not just body weakness. But there is renal failure, there is severe anemia, there is hypoglycemia, there is coagulopathy where the INR is affected and the PT may be affected. There may be cerebral malaria, there may be parasitemia. I think it should be 5% and above. You people know that better than me. Okay, so all those ones are components of severe malaria, but not just body weakness. It should be severe body weakness. Okay, let's go. All right, so the next question said, which of these tests below is used to determine the species of the Plasmodium? There are several tests that you do for malaria: the thick blood film, the rapid diagnostic test, and the thin blood film. So which one is used to determine the species of the Plasmodium? It should not be Plasmodium, of the malaria parasite, right? It should, sorry for the typo. So it should be of the malaria parasite. So which one is used to determine it? To determine the species of the malaria parasite. Okay, I saw CCCC. Okay, indeed the answer should be C. Let me make some adjustment I needed to make. This should be malaria parasite. Okay, so okay, yeah, the answer is C. Yeah, you do thick film to determine it. The thin film will just determine if you have malaria parasite and what is the amount, but for the species you have to do thin film. The rapid diagnosis is very good, especially if you are doing, you need rapid results to manage the patient. You cannot wait for the microscopy, or it is also used during community outreaches, or where you are doing a population-based treatment, right? So the rapid diagnosis tech is used. Okay, so the answer is C actually. All right, let's go. Which of the following drug is not used to treat severe malaria? That's the next question. Intravenous artesunate, okay, Khadija said B. Okay, yeah, Ateita. Ateita is not used for the treatment of severe malaria. Okay, so very good. It's artesunate or quinine. So, but what we use here is mainly we use here is mainly we use IV artesunate most of the time. Okay. All right, so the next question is, which of the following group of people require malaria prophylaxis? Okay, except sickle cell anemic patients, pregnant women, immunocompromised people, travelers to any part of the world under 5. Okay, so which one? I've seen that Fatima has given an answer. Any other ideas for number 37? Any ideas for number 37? Okay, I've seen different answers. So for number 37, the answer is D actually. It's not travelers to any part of the world. It has to be travelers to endemic areas. So that the catch there is travelers to any part of the world. No, it has to be travelers to endemic areas. If you say travelers to any part of the world, that is wrong. It has to be people, Nigeria is part of the endemic areas. So it has to be travelers to endemic areas like Nigeria. But all the other options are true. So we're on meningitis. Okay. So which part of Nigeria, or the typo, but the question should be which part of Nigeria is the meningitic belt? So that should be the question. Which part of Nigeria is the meningitic belt? which part of Nigeria is the meningitic belt? Okay, so any answers for me? Which part of Nigeria is the meningitic belt? Number 38. Do I have answers? Okay, so the answer here should be B. It's northern Nigeria that is the meningitic belt, not any other area. Northern Nigeria is the meningitic belt. Okay, let's move forward. You know, they taught you meningitis. These are the things that they will likely ask you. Some simple questions that are important. They are likely to ask you those questions. Okay, so then the next question, we are almost through. Which of the following are common causes of bacterial meningitis? Is it Neisseria meningitidis, Strep pneumo, Listeria monocytogenes, Haemophilus influenza? So which one is odd among them? So sometimes they will give you an option like that. So you choose the one that is not common, the one that is odd. So the question is, because you people are not used to MCQ, that's why I'm giving you that hint. So this question is intended for you to select the one that is not common. So which among this list is not common? Which among this list is not common? Right? Because all the other ones are common. That's how we ask questions sometimes. Okay? So if they ask you, because we did not say the most common. If it's the most common, you choose the most common. But if you see a question like that, they are asking you to choose the odd one. And the odd one, I'm seeing it clearly. Okay? So that's what you use. But I am very sure your lecturers will not ask you this kind of question. And that's why I explained myself. So which one is the odd one here? Okay, so I can see that some of you have already gotten it already. So the odd one is Listeria monocytogenes. It's not common. The three most common causes are the Neisseria meningitidis, Strep pneumo, and Haemophilus influenzae. Okay. All right. So let's move forward. The following are serotypes of Neisseria meningitidis that cause epidemics except. So which of these serotypes of Neisseria meningitidis is not associated with epidemics? So what is the answer here? This is the second to the last question that we have. Which of these is not? Which of these is not? A serotype. Okay, I saw C. Okay, Mahmoud Musa says C. Any other person? Any other person? Okay, so I agree with him. The answer is C. The answer is C. Okay, yeah, the answer is C, because D is not a serotype. We have A, B, C, W, Y, okay, as serotype. In northern Nigeria, the last one I think we got was serotype B. Okay, so you need to know the serotypes that are associated with epidemics, and the northern Nigeria is the belt for epidemics. So the last question is, which of the following is not a macroscopic feature of CSF in a patient with bacterial meningitis? You know, if patient have meningitis, one of the tests we do, or one of the defining tests, is CSF analysis. So when you put your needle, you bring out the CSF. So in bacterial meningitis, there is a way you see the CSF. Let me answer this myself. So the CSF will be definitely turbid, and sometimes if it's traumatic, there may be subsequent xanthochromia. Those xanthochromia is common in subarachnoid hemorrhage, and there may be also high output pressure. Okay, but xanthochromia is not commonly seen in bacterial meningitis. Is usually seen in subarachnoid hemorrhage. Those strands may be seen in CSF in bacterial meningitis, but is commonly seen in tuberculous meningitis. Please take note of that also. Strands in CSF is commonly seen in tuberculous meningitis. Okay? So, any questions? Hope you guys have learned some things. I think you people will finish your posting next week, or is it per week? We'll try and see how we cover the other specialties that we haven't on a weekend, especially gastro and nephrology. So any question for me? If there are no questions, you type thank you, sir, so that we'll conclude. All right, you're welcome, Mahmoud Musa. Thank you for being active since from the beginning. Mahmoud Musa, you have been very active in the discussion. Okay. Any other question? Okay. Abdul Salam also said thank you, sir. Okay, thank you, sir. All right. So thank you also for being patient with me today. I wish you a restful night. Good night, everybody.